Hernias are most common in the abdomen, but they can also appear in the upper thigh, belly button, and groin areas. Hernias are found in both men and women, more commonly in males. A hernia occurs when an organ pushes through an opening in the muscle or tissue that holds it in place. The Georgetown Public Hospital performed 64 surgeries on 50 patients. Despite the backlog of operations, the criteria for selection was based on urgency, availability, and willingness to do the surgery. Doctors say all surgeries were successful. In responding to a question from Nightly News, head of department of the General Surgery Unit, Dr. Navin Rambaran, says early detection of hernia remains a factor among most gynaes.
But generally these are conditions, inguinal hernias are conditions that are there for usually what we see, patients who would have had them for several months, sometimes for years, and then they seek treatment. I believe that the culture has to shift a bit from not accepting a new normal with regards to swelling to the groin to one in which when something changes, you seek medical opinions.
Dr. Rambaran further noted that there has not been an increase nor decrease in the number of persons going into the hospital for symptoms of hernia. He says persons are checked daily for hernia.
I have not seen any big increase in the prevalence within the clinic. There's just have been a constant flow of patients presenting with these illnesses.
What are the age range?
I have not disaggregated the stats, especially in the cases that we have done, but we see a fair mix of younger patients, young adults. We see middle-aged persons, and certainly we see older persons with it.
Meanwhile, Chief Executive of the GPHC, Brigadier Retired George Lewis, expounded on what will happen next with regards to other patients awaiting surgery for hernia.
Hernia surgeries and some other surgeries are elective surgeries. It means basically they are programmed. It is done at the Georgetown Public Hospital and at every single hospital throughout the country and perhaps throughout the world, where surgeries are programmed. What we were attempting to do is to reduce the length of time that the person has to wait to get their surgery. Basically, that is what Operation Hernia does.
Javon Vickery, HGP Nightly News.